Welcome back. We're continuing the news. The World Health Organization, WHO, is warning of a two-track pandemic and has renewed calls for vaccine makers to share doses with Covax. On the other hand, UNICEF has warned that millions of COVID vaccines could be wasted if rich countries send large amounts of leftover doses to poorer nations in one go. Shamala Pullen tells us more.
Over the last few weeks, countries around the world, including Jamaica, have been seeing a decline in COVID-19 cases. But while this is good news, there's a concern. At the latest media briefing on Monday, the World Health Organization WHO said with variants including Delta still circulating, countries lifting restrictions must be careful. The WHO says this can be disastrous, especially for those who are not vaccinated.
In these countries, the continued use of tailored public health measures is the best way to suppress transmission. The inequitable distribution of vaccines has allowed the virus to continue spreading, increasing the chances of a variant emerging that renders vaccines less effective.
The WHO says even in an emergency, low-income countries cannot rely solely on imports of vaccines from wealthier nations.
2 months ago, the African Union launched the Partnership for African Vaccine Manufacturing, and several countries are making progress. I hope that some manufacturing sites will be identified and at least close to producing vaccines by the end of this year.
The WHO said boosting vaccine manufacturing will not happen overnight, but the sooner the investment, the sooner the manufacturing will start.
We have received expressions of interest from a number of companies interested in transferring their technology and from a number of countries wanting to receive the technology and set up production plants. We're conducting a technical review and will soon engage in discussion with member states and partners to start implementation.
Meanwhile, UNICEF has warned that millions of COVID vaccines could be wasted if rich countries send large amounts of leftover doses to poor nations in one go. The charity said there needed to be a steady supply throughout the year because poor countries do not have resources to use them all at once. Shamala Pullen, TVJ News.